Hi, my name is Bill and I'm a college professor in Dallas, Texas, and today I want to discuss my favorite question, why? I always like to tell my students why we're studying something, why it's useful, and when I read a news report, I'm always wondering why, and I'll dig down until I get to it. So I was reading a report that Blue Cross Blue Shield, one of the nation's largest health insurance companies, maybe the largest, is on the verge of bankruptcy. So they're going to start reducing what they cover and how much they're willing to cover and what they pay for that coverage, and of course charging us more for that coverage. So it sounded weird to me. Blue Cross Blue Shield is on the verge of bankruptcy. Why? So the why is because insurance claims are up, healthcare is getting more expensive, more people need it for more things. Okay, why? Well, one of the other things I've been studying is the impact of our food system on our public health. Even Robert Kennedy Jr. has identified some of these issues, although I don't think he's actually going to do anything about them. But for example, high fructose corn syrup is one of the most ubiquitous ingredients in everything that we eat and drink, and that destroys your mitochondria. Mitochondria being the power cells of the body. Then you see the drug commercials, which I don't normally see, but this time of year, NBA playoffs, I do see some. And the commercials are all these things that, this will cure whatever, blah, blah, blah. But then there's like 90 seconds of all the things that the cure will cause. And I think, first of all, why would I ask my doctor about a drug? Why don't I go to the doctor and explain what's going on and the reason why I'm there and ask my doctor, who has a degree in medical practice, what to do about it, not go to the doctor and say, hey, I'd like to ask you about this drug I saw on TV. That just seems ridiculous. But our food system is feeding us to the pharmaceutical industry. The pharmaceutical industry is then killing us with the drugs that they are providing, that we're getting prescribed. And there are actual, in many cases, you don't need a prescription, you don't need a pharmaceutical. There are simple behavioral things that we can do to correct many of the things that are wrong with us, but we've become a pill-driven society because of all the commercial interests looking at us as nothing more than consumers. So I want you to ask yourself why when you see news questions. I want you to try to figure out what's the story behind the story. And at the end of the day, this is another one of those things that if we had public funding of elections and we had single-payer healthcare in this country, we would all be a lot better off. You know how to get that, don't you? You call your senators, you call your representatives, and Democrats have been talking about this for years and ultimately weren't willing to do it any more than Republicans. They don't even care about it. So let's pressure our elected officials. They do listen, some more than others, but they do listen. As always, thanks for watching.